Hello and welcome to Amberwell Hiawatha. My name is Jared Abel. I'm the Chief Executive Officer here at Hiawatha. I want to talk a little bit today about some exciting stuff that we're bringing to the community, some new services and some expansion of services that we think are going to really bring value to our local community, keep care here, provide excellent service. Here we've been working hard on expanding things like pharmacy, bringing new clinical services online. But today we want to talk about a specific imaging service that we're bringing here. So I'm going to talk today with my colleague, Kristen Beyer, our Director of Radiology, talk about the addition of a full-time nuclear medicine department here at Hiawatha.
So Kristen,
Yes.
first of all, nuclear medicine.
Mhm.
I know we're going to go see the machine and we're going to talk specifically about what that is when we get there. But if I'm a patient, we're sitting here in our beautiful front lobby.
Yes.
Tell me about where I would come, where I would check in, where I'm going to wait, and what kind of experience I can expect if someone tells me I need to come to Hiawatha to get a nuclear medicine study.
Okay. So you come through the doors into the lobby. First, you'll check in with registration at the desk, and then you'll come to the waiting room and have a seat. So it'll either be the nurse from cardiac rehab if you're having a stress test, or it'll be our nuclear medicine technologist that will come grab you for your scan. And here's where the scanner is.
All right, Kristen. So you get an order, you check in, they come get you, you're going to bring you back here to the scanner. What are the main things that you anticipate that patients are going to be seen for when they're on? Is it going to be gallbladders and cardiac care?
Gallbladders, other general studies that you will see a lot would be bone scans. So there's different types of bone scans. If you have a broken bone and you're not able to see it on another type of diagnostic image, if it is a hairline fracture, a lot of times you can have a bone scan done and that will show you where it's fractured, if it is in fact fractured or broken. And we also do a lot of gastric emptying studies, which are very popular now with the rise in the semaglutide and trizepatide medications. And then along with the heart scan. So all of your stress tests, you'll be able to see the function of your heart. You can do it with exercise, which includes the cardiac rehab and their treadmill, or you can have it without the exercise where you do it on a bike or something different that doesn't involve the treadmill.
But the big deal, and the big deal for the community, is that this is now a fixed, on campus, on site diagnostic tool that we'll have available to us 5-7 days a week.
Yes.
So maybe talk a little bit about that and what we've got here.
Yes. So for our stress tests, those are something that we've only been able to do with a mobile truck, and it's 1 or 2 days a month. Also with our general studies like the bone scans, the gallbladder scans, those studies we haven't been able to do here in Hiawatha for, I'd say, between 5 and 7 years. So this will bring that back to your local community where we can get you in. A lot of them you'll be able to have done next day or same week with a tech that you know and the radiology department that's been here.
You mentioned stress tests.
Yes.
Those also have other equipment that's not just this, correct?
Yes. So with the stress test, you have the actual stress part of the scan, and that is when the cardiac rehab, they come in and they hook you up to equipment, to all of your EKG, and you're hooked up while you're exercising, while you have the isotope that is an injection going through you so that they can see the function of your heart. And while that is doing it, then you'll have a part where you come to the scanner. And that's where they actually take the pictures of the heart. So multiple parts working together.
So you mentioned with a tech that you know. So who's going to actually be doing this work?
So this will be done with Jeremy Forkenbrock. He has gone to the training to do this. He's been here for about 6 years now. So it's nice to have him here to do this. So along with the stress test, we'll also have Dustin Williams in here, who is the ER provider. He's a hospitalist. He comes in and he watches the monitor while you're having this done to ensure that the second you may have something happen, he is here for you. The cardiologist, if you already have a cardiologist that you see, they will be that group that's reading it.
And as far as getting an order.
Yes.
So what types of providers, you mentioned, we might be from an ED setting, it might be from a cardiologist, it might be from primary care. Any of those we can take here and we can perform?
Yes. So we can take orders from anywhere, from any provider that has ordered a scan for this. We can do those in-house. If you're having problems getting into another facility, time-wise, or they just don't have it on the schedule or they're not going to be there for another month, you can give us a call and we can work on getting you in.
Will this be available every day? Will this be available on certain days?
Yes, so this will be available every day, Monday through Friday. Yes.
Now, like any imaging study, there's often radiological isotope on site, but being new service, being here more often, sounds like you feel like we're going to have really good availability, especially compared to some of the larger hospitals where the waits are a little longer.
Yes, yes, for sure. We have direct contact with our pharmacists and our providers, and we can call and get an isotope whenever we need it. A lot of times that will be the next day.
We're excited to be able to offer high quality, easily accessible, friendly local care that gives you the level of care you could get at other locations, but does it right here in your local community. So again, thank you, Kristen and team. Excited to bring this to the community and add this service to the portfolio here at Amberwell Hiawatha.